I'd like to now circle back and finish off the discussion about seed oils. And I believe the evidence of harms from seed oils are now convincing enough that we should be all discouraging their consumption. The consumption of seed oils began to rise in the early 1900s, well timed to have a causal role in the heart disease epidemic. And it's not just this association that suggests their consumption is problematic. 4 randomised controlled trials, the gold standard of research, have demonstrated the harm of consuming these seed oils. In this study from 1965, patients post-heart attacks were randomly allocated to one of 3 groups. There were 2 intervention groups consuming either olive or corn oil, also recommended to reduce their saturated fat intake, and a control group on a regular diet. After 2 years, 75% of the subjects in the control group remained free of repeat heart attacks, compared to 57% and 52% of the olive and corn oil groups, respectively. Hardly a ringing endorsement for olive or corn oil. The conclusion of the investigators was quite blunt, in fact. Corn oil cannot be recommended in the treatment of ischemic heart disease. And in my opinion, this study also raises questions about olive oil. The Sydney Diet Heart Study was a randomised controlled trial examining the effects of replacing saturated fat with polyunsaturated fat in men who'd had heart attacks. But despite being finished in 1973, the results on whether this intervention reduced cardiac mortality were destined to never actually be published. It was only after Dr. Chris Ramsden uncovered the raw data on punch cards and magnetic tapes buried in a basement that the full results were eventually published some 40 years later. The key finding being that the increased intake of polyunsaturated fats, as found in seed oils, increased the risk of death by 62%. A similar story exists for the Minnesota Coronary Experiment, which also finished in 1973. Remember, this was just before the food pyramid came out. If these studies had been published, do you think we would have ended up with the food pyramid the way it was? It would be madness. It was a double-blinded randomised controlled trial on more than 9,000 men and women, again evaluating the effect of increasing dietary polyunsaturated fats. And again, there was an inexplicable delay in publishing the full findings. It took 16 years to just publish a few redacted findings. And when the results were finally published 43 years later, again after the raw data was located in a basement, it was revealed that increasing seed oil intake increased the risk of death, a result that was knowingly hidden for decades. And when the now deceased lead author was asked about this delay of publication, he explained it was because the study results were disappointing. More recently, we've got the Women's Health Initiative study. So published first in 2006, it was a massive study of over 48,000 females designed to definitively assess the benefits of lowering saturated fat and increasing polyunsaturated fat intake. The most important outcome of this kind of study clearly being survival. And while the results were technically published, they were done in a very obscure manner, almost like the authors didn't want anyone to actually see them. This vague sentence on page 661 of the publication was the single reference to the only statistically significant finding within the whole paper. Remember, this study cost $700 million US, and that was the best they could do. The finding being that females with a history of heart disease faced a 26% increased risk of complications like heart attacks if they followed the intervention diet. Furthermore, the most recent published data demonstrates that the risk of the low-fat intervention group increased over time to between 47 to 61%. And interestingly, in further subsequent publications, they've now stopped publishing that data altogether, even when you go through it with a microscope.